Welcome back, friend. In this video, we will get right to the bread and butter of what you need to assess every shift when you are on a nursing ward and taking care of a patient with a central line. Central venous catheters must be flushed every day to prevent clotting and keep it clear of blood. Each lumen should be flushed in the same order each time. Depending on the type of catheter, flush it with either heparin or saline solution. Pay attention to the MD order. Usually, you will be expected to flush the central line Q8-hour shift or every 12 hours. Assess the skin at the point of entry or insertion. Observe for any redness, erythema, swelling, drainage or leakage, or pain at the site. If you notice swelling, make sure to mark the area with a pen and notify the RRT nurse, charge nurse, and MD on call. Assess for the stability of the dressing, catheter, and tubing, and that each unit is secure. Notice if the dressing is correctly labeled with the date, time, and nurse's initials. Does the patient experience any sensitivity around the surrounding tissue, for example, pain, burning, or itching, which may be signs of a chlorhexidine sensitivity? Note the position of sutures if they are present. Perform tracer. Verify that there is the correct solution infusing, additives, rate of infusion, and expiration date. Are the IV tubings currently labeled with the date and time of the next scheduled change? Make sure each lumen has a lumen cap on to prevent entry of infection. Measure the extremity, 6 to 12 centimeters above the insertion site for all Picc lines. Make sure to assess the dressing and site every shift and PRN for signs and symptoms of infection. Change any moist antimicrobial patch or moist and loosened dressings immediately to prevent CLABSI or central line associated bloodstream infection. Confirm measurement of the central line in the electronic health record. You can find a paper measuring tape typically in your hospital supply cabinet. Measure the circumference approximately 6 centimeters above insertion site and measure the exposed catheter length from the insertion site to hub. Report all abnormal signs to the RRT nurse, charge nurse, and MD on call. A central line is a tiny tube that is placed in a vein for long-term drug therapy or kidney dialysis. So these assessments matter and are very important in the progression of care. Thank you for watching our video. Please subscribe to our YouTube channel to support our growth.